ACL repair, when we try to suture the end-to-end of the ligament without replacing it, usually we do it in special circumstances when the patient is very young, or when the blood supply to the ligament is very good. This is in comparison to reconstruction, which is you have to replace the ligament with another ligament which comes from somewhere else. The ACL could be reconstructed in a different way, but the most common and successful way is taking graft from somewhere else of the body, usually the hamstring or the filar tendon, and this graft to replace the ligament and fix then the femur and the tibia in order to replace the old ligament and restore their function fully. Its routine procedure has a lot of technical aspect which make it which probably make it a demanding surgery. This is why it's a very specialized area, and if the surgeon is not doing this surgery regularly on a weekly basis, can be very difficult operation. But it is a routine and technical demanding operation. Always there is a lot of technology with orthopedic surgery, and with the specific on the ligament reconstruction, there is different fixation technique which will allow us to put the ligament in the anatomical point, so we can have a near anatomical ligament to replace the old ligament, and the technique of fixation become more advanced, in a way become more reliable and more stable, so we have less failure with the fixation of our new ligaments. The surgery designed to replace the ligament with a stronger ligament than we had before. Function will go back to near normal what was before, but it will never be 100% like the natural or the native ligament, as the nerve supply in the ligament will never be back to normal. What we call it proprioception, that the ligament has some nerve in the nerve supply, which usually find it in the native ligament, but the replaced one will never have this function. This is why there always will be some difference from the normal. The most important factor in the recovery from ACL surgery is the exercise and the physiotherapy. And I will say 50% of the success of the surgery will be to the operation technique itself by the surgeon, and another 50% by the physiotherapy and by the input from the patient to comply with the exercises post-operatively. And the more comply with the exercises and the protocol of the physiotherapy, the better outcome and more successful function we get for the surgery.